Good morning, class. In this recording we're going to begin our study of the GU system. And in this recording we're going to cover a brief overview of the kidneys and the functions of the kidneys. The kidneys have varied functions, including filtration of the blood, regulation of the blood pressure and blood volume, activation of vitamin D, production of erythropoietin, and ultimately lead to elimination of waste. So as we're thinking about filtration, we're going to talk about how the kidneys filter the blood. They filter out the waste, they maintain appropriate balances with our electrolytes and acid-base balance. If the kidneys fails, we have increased waste in the circulation, and that results in disequilibrium of the fluids and electrolytes, a decrease in activation of vitamin D, which can result in decreased calcium absorption and subsequently hypocalcemia, and decreased erythropoietin, which can lead to anemia. The kidneys are located right below the 12th rib, and you can see here they're a good way to look or feel for where the kidneys are is that costovertebral angle. So we have two kidneys, and we can live with just one kidney functioning. This is a cross section of the kidney. The right and left renal arteries branch off from the abdominal artery and enter the kidneys, and so we've got the renal artery perfusing the kidneys. The entire blood supply circulates through the kidneys in 4 to 5 minutes, and the nephrons are the functional units of the kidney, and so they're located here, and here's a expanded version of one nephron. We have 1 to 1.25 million nephrons in each kidney, and they contain a glomerulus, which are tufts of capillaries that filter large proteins and blood cells. Water, electrolytes, and solutes are reabsorbed in the tubules, so you see the tubules here. Okay, there's the glomerulus, there's the tubules. Other solutes such as creatinine, hydrogen ions, and potassium are excreted. Water and solutes that are not reabsorbed become urine, and so whatever's not reabsorbed here will end up making urine, and so then the urine will collect and flow through the urinary system. The kidneys, in conjunction with the antidiuretic hormone, work to maintain balance with water, and renin, an enzyme produced by the kidney, affects the angiotensin I and angiotensin II system and aldosterone system to regulate blood pressure. So what happens here in the nephron is glomerular filtration, tubular reabsorption, and tubular secretion through these processes. Urine is mostly composed of water, sodium, potassium, chloride, urea, creatinine, and uric acid. The body normally produces 1 to 2 liters of urine a day, and urine usually does not contain glucose and proteins unless there's something wrong. The bladder usually holds 200 to 400 milliliters of urine, and then we feel the urge to urinate. But it can distend much more larger and hold larger volumes. Typically, normally, a person urinates 5 to 6 times a day and 1 time at night. The amount of urine produced is affected by many factors. And this just shows you the urinary system. Your kidneys make the urine, and then the urine flows down through here, through the ureter to the bladder, and then is excreted through the urethra. So factors that can impact urinary elimination are listed here. When we think of the term urinary elimination, some other terms that you may hear for this are urination, voiding, or maturation. So some factors that can alter the normal output or impact the normal output include food and fluid intake. Output is usually balanced with intake, and certain fluids, such as alcohol, inhibits the production of antidiuretic hormone, so therefore we have increased output. Foods and fluids high in sodium cause fluid retention. Muscle tone. Good muscle tone maintains elasticity and contractility of the detursor muscle, allowing the bladder to fill and empty adequately. One factor that can alter this muscle tone is long use of a Foley catheter. It can cause poor bladder muscle tone. Psychological factors that impact urinary elimination include privacy. Sometimes running water will stimulate the voiding reflex. Positioning and sufficient time to urinate can also impact urinary elimination. And we're going to talk about in some other recordings specific pathological conditions that impact urinary elimination. But some examples include renal diseases, heart and circulatory disorders such as heart failure, shock, and hypertension. And then pathological changes in the system, and perhaps stones can interfere with passage of urine. Any surgery done on the urinary system can cause inflammation and cause bleeding, which can impact urinary elimination. And there are a variety of medications that can affect urinary elimination. Some drugs that can cause urinary retention. Some examples are anticholinergics, antispasmodics, antidepressants, antipsychotics, antihistamines, beta blockers, and opioids. Diuretics increase urine formation by preventing reabsorption of water and electrolytes, so therefore they increase urinary output. Lastly, in this recording, I just wanted to touch on diagnostics. There's a variety of diagnostics used depending on the patient's complaints and symptoms. The two main ones that I wanted to talk about, though, and you can look up the rest of these, but I just wanted to talk briefly about serum creatinine and blood urea nitrogen. Creatinine is the end product of protein and muscle metabolism. It reflects glomerular filtration, so it's how much is being filtered. Renal disease is the only pathological cause for an increase in creatinine. And then the creatinine levels range different for males and females. A normal serum creatinine for a male is 0.6 to 1.2 milligrams per deciliter. A female is 0.5 to 1.1. An increase in the serum creatinine obviously indicates kidney impairment. A decrease can be caused by a decrease in muscle mass. The BUN indicates the extent of renal clearance of urea nitrogen waste products, and so that's one of those waste products that the kidneys are responsible for getting rid of. And so urea nitrogen waste is a byproduct of protein metabolism in the liver. And so a good judge of how the kidneys are functioning is to look at the BUN as well. A BUN typically in a normal adult is 10 to 20 milligrams per deciliter. It does range different levels as we age. It increases actually. An increase in the BUN can be attributed to hepatic or renal disease, but it can also be attributed to a number of other factors, including dehydration, or decreased kidney perfusion, a high protein diet, infection, stress, steroid use, GI bleeding, or other situations in which blood is in the body tissues. A decrease in the BUN may indicate malnutrition, fluid volume excess, or severe hepatic damage. I encourage you to take some time and look at these other diagnostics, look them up, and become familiar with the nursing implications for those. This concludes this recording. Thank you very much.